you found this video, you've probably been searching for some information on methadone. Just some basic background on methadone. Methadone is a synthetic opioid, usually prescribed to help manage moderate to severe pain, and it can also be used to help treat opioid addictions, especially addictions to heroin. How methadone works is it actually attaches to the same opioid receptors as other opiates like heroin or even morphine to stabilize the patient and to minimize withdrawal symptoms. Methadone blocks the pleasurable sensations and the euphoric effects that other opioids cause. It doesn't give the user any sort of high, but some people still use it when they are in search for a high. People who use methadone to overcome a heroin or other opioid addiction are higher risk of becoming addicted to methadone than somebody who's just using it for pain management, just because somebody who's already been addicted to heroin or any other opioid, they have that past of being addicted to an opioid already, so they're predisposed to it. So methadone is kind of controversial. The arguments are that it's good and it can save our government and taxpayers a whole bunch of money. It helps recovering addicts. The other argument is that it just switches the addiction from one drug to another. So it's really important to understand the risk and the benefits. Some of the benefits of methadone and methadone maintenance treatment. For one, methadone is more cost effective than other options such as incarceration or just leaving untreated people in our communities. Studies show that it takes about $42,000 per year to leave a drug user untreated in our community. And studies also show that it takes $40,000 to incarcerate one person rather than getting them treatment. So on average, methadone maintenance treatment costs $3,500. That's a huge difference. $42,000 leaving them untreated on the streets, $40,000 incarcerating them, $3,500 to get them the help that they need. And according to the NIDA, illegal activity by MMT participants went down by nearly 52%, and then time employment for people involved in methadone maintenance treatment actually went up by 24%. Another positive to using methadone as an addiction treatment or methadone maintenance treatment is that it saves us money in the future. So not only does it save us money now actively instead of spending $40,000 on them, it saves money in the future too. There was a study done by the California Drug and Alcohol Treatment and 150,000 patients, and they actually found that for every dollar spent on treatment, $7 in future costs were saved. So you can already see how much money is starting to add up by just paying for treatment rather than other options. MMT is also shown to drastically reduce the risk of developing communicable infections such as HIV or hepatitis or tuberculosis. Another positive to methadone is that there aren't really any major side effects that come with the drug. The only minor side effects that have been found are constipation or excess sweating during the early stages of treatment. So one of the major downfalls that people see with methadone is that it is a synthetic opioid, so it does contain the same possibly addictive properties. So it is important that people who are using methadone are being monitored and have the right dosage, so it's something that's helping their addiction rather than just transferring it from one drug to another. Since the opioid epidemic is such a huge problem right now in our country, I think it's really important to look at all the facts associated with methadone and all the good that can come from this drug, rather than just focusing on the fact that it is technically an opioid. So if you or somebody you know is struggling with addiction, don't hesitate to get help, because help is out there. There is a website that is called addictioncenter.com, and there's plenty of information about how to find the right treatment for you, the right treatment center. Website also provides information about insurances and insurances that will cover treatment. There's a 24/7 free and confidential line, if you would like to call it, to get help. The number for this line is 855-706-9275. I really hope that this video provided you with the information that you were looking for. And remember that addiction isn't a joke. And remember that addiction is hard to overcome, but you can do it. And don't be afraid to reach out for help.